So it's okay to have acupuncture during labor. And really, if we think pre-pandemic, I was attending a lot of births. And so I would attend a birth as an acupuncturist sometimes just to come in and facilitate a change. And then sometimes I would be there the whole labor and birth for as a doula, as an acu-doula. So it is definitely okay to have acupuncturists in your labor. And now during the pandemic, I don't believe anybody can go in except one person. And that one support person is typically the partner of the mom. So if a doula does go, it's only one person who stays for the birth and the recovery the whole duration of the time. So it's an interesting time for acu-doulas because I don't know if we can get in the hospital, but we can help at home. So oftentimes women will labor for a long time. They'll be in prodromal labor, early labor, whatever you want to call it, at home. And that's something we could come to their house and we can support them by naturally promoting their labor. We would help turn on all the right hormones to get things going. We can help with pain reduction. We can help with nausea and vomiting during labor. And most importantly, stress. It's such a stressful time. And if they're having prodromal labor, where the labor is going on for several days, it's very stressful. They have their in-laws in town and they have their, the sibling and the toddler, and they're juggling all these things, and the labor is taking a few days. So it's definitely okay and safe to have acupuncture. And you would have to check with your hospital. Here in San Diego, I know ahead of time that certain hospitals are okay with it and certain hospitals are not. So if I were called to a birth in that hospital when I was allowed to go to the hospital like normal, I would just make sure if it's in this hospital, I'm going to do acupressure. And if it's in that hospital, I might do acupuncture. But I would only do acupuncture in the hospitals that were allowing us to do so.